One essential vitamin to keep your legs strong in old age, even at 94. Senior Health and Wellness. Want to stay strong and active well into your 90s? Discover the one essential vitamin that can keep your legs powerful and your mobility intact, no matter your age. Don't miss this life-changing advice. Learn how to protect your independence and vitality today. Watch now. As we age, many of us start to notice subtle changes in our bodies, especially in our legs. We might feel a little more tired, find it harder to get up from a chair, or struggle more with climbing stairs. At first, it's easy to dismiss these changes as just part of getting older, but what if they're more than that? What if there's something going on inside your body, silently draining your strength and making every step harder? The truth is, for many people, this weakening isn't just about age. It's about a deficiency in something essential for muscle strength and stability. You may not realize it, but muscle weakness and poor balance are quietly creeping in, slowly stealing your ability to stand, walk, and live with the independence you deserve. And this gradual loss of strength often leads to a serious consequence: falls. Every year, millions of older adults lose their mobility, not because of an accident, not because of disease, but because their muscles simply give up. The worst part? It happens so gradually that most people don't even realize what's happening until it's too late. But here's the good news: there is a way to keep your legs strong, steady, and powerful, even as you age. The secret? There's one essential vitamin that plays a crucial role in keeping your muscles strong. It's a vitamin that many people overlook, even though it's so powerful that without it, your muscles weaken faster than you think. This vitamin is vitamin D, and without enough of it, the body's muscle function deteriorates, balance worsens, and the risk of falling skyrockets. Vitamin D is commonly thought of as the nutrient that strengthens bones, but its role goes much deeper. In fact, it's just as important for muscle health, stability, and mobility, especially as we get older. Without adequate vitamin D, your muscles start to lose their strength, and you'll notice that simple tasks like walking or standing become increasingly difficult. One groundbreaking study from the Journal of the American Geriatric Society found that seniors who took vitamin D supplements had a 23% lower risk of falls compared to those who didn't. Another study published in the Journal of Clinical Endocrinology and Metabolism revealed that older adults with low vitamin D levels had weaker leg muscles and slower walking speeds. So no matter how much you exercise or eat healthily, if your body is lacking in vitamin D, your muscles will still struggle to stay strong. And here's the most alarming part: over 60% of older adults are vitamin D deficient, and they don't even know it. Unlike other nutrient deficiencies, the signs of vitamin D deficiency are subtle and can go unnoticed for years. You might just feel a little more tired than usual, or maybe your legs feel weaker when you stand up. It's easy to chalk it up to getting older, but this deficiency is silently causing damage to your muscles, balance, and overall mobility. Without enough vitamin D, muscle strength gradually declines, and it becomes more challenging to do everyday activities. The real danger, however, comes when vitamin D deficiency goes unchecked for too long. As vitamin D levels drop, your muscles lose strength, and your balance deteriorates, making falls far more likely. For many seniors, a fall doesn't just result in bruises, it leads to broken bones, months of recovery, and often, a permanent loss of independence. Why does this happen? As we age, our ability to produce vitamin D from sunlight naturally declines. So even if you spend some time outside, you might still be dangerously low in this essential vitamin. In fact, studies show that older adults who have low levels of vitamin D are twice as likely to suffer from serious falls and fractures. For women over 65, the risks are even greater. A study from the New England Journal of Medicine found that taking vitamin D supplements can lower the risk of hip fractures by 22%. This is a significant finding, especially because a hip fracture can change everything for a senior. It often leads to long-term disability or loss of independence. Unfortunately, vitamin D deficiency is often not something you notice right away. It's a slow, insidious process that creeps up on you. Early warning signs include muscle weakness, bone pain, slow wound healing, and frequent leg cramps or spasms. If you've noticed any of these symptoms, whether it's feeling more tired than usual, struggling with movement, or experiencing pain or weakness in your bones, it's time to pay attention. Muscle weakness is one of the first and most noticeable signs of vitamin D deficiency. It makes simple tasks, like getting up from a chair or walking, feel more difficult than they should. If your legs feel shaky or unstable, that's a clear sign that your body isn't getting the nutrients it needs to keep your muscles strong. As vitamin D levels drop, it becomes harder to maintain muscle coordination, and balance becomes much more challenging. Bone pain is another critical indicator. Vitamin D is essential for calcium absorption, which is necessary for bone strength. If you're experiencing joint aches, pain in your legs, or discomfort in your lower back, you might have low vitamin D levels. This can lead to conditions like osteoporosis, where the bones become brittle and fragile, increasing the risk of fractures. The longer you ignore these signs, the more damage it causes to your bones, and the higher the chances of serious injury. What's even more concerning is that vitamin D plays a crucial role in the body's ability to heal. If you've noticed that small cuts or bruises take longer to heal than before, it's possible that your vitamin D levels are low. Vitamin D is essential for tissue repair and immune function, so if you're not getting enough of it, your body won't heal as quickly, leaving you vulnerable to infections and more severe complications. And then there's the issue of frequent leg cramps or spasms, especially at night. These painful cramps are a sign that your muscles aren't getting enough calcium, which depends on vitamin D for absorption. If your body doesn't have enough vitamin D, muscle contractions become irregular, leading to painful cramps, particularly in the legs. So, how can you fix this? The good news is that increasing your vitamin D levels is relatively simple. The most natural way to get vitamin D is through sunlight. Your skin is designed to produce this vitamin when exposed to sunlight. Ideally, you should aim for 20 to 30 minutes of sun exposure at least 3 to 4 times a week. However, if you live in a place with limited sunlight or spend a lot of time indoors, getting enough vitamin D from the sun can be difficult. In these cases, you may need to rely on other sources of vitamin D, like food or supplements. Fatty fish like salmon, mackerel, and sardines are rich in vitamin D, as are egg yolks, fortified milk, and certain plant-based milk alternatives. If you're not getting enough from your diet, vitamin D supplements are an effective solution. A doctor can help you determine the right amount of vitamin D for your body, especially if you're at risk for deficiency. Vitamin D also needs magnesium to be absorbed properly, so make sure you're getting enough magnesium in your diet through leafy greens, nuts, and seeds. This can help your body make the most of the vitamin D you're taking. But the most important thing is to stay consistent. It might take a few weeks or even months to feel the full effects of improving your vitamin D levels, but when you do, the changes will be life-changing. You'll start to feel less fatigued, your legs will feel stronger, and you'll be able to do things that seemed difficult just a few months ago. Your balance will improve, reducing the risk of falls, and your muscles will start to regain their strength. Over time, you'll notice a significant reduction in joint pain, and your overall energy will increase. In the long term, keeping your vitamin D levels up is one of the best ways to ensure your legs stay strong, your balance stays steady, and your independence remains intact well into old age. The sooner you take action, the sooner you'll feel the benefits. The choice is yours. Take charge of your health today and give your body the nutrients it needs to thrive. Remember, maintaining healthy vitamin D levels is not a quick fix, it's an ongoing commitment. But with the right approach, you can keep your muscles strong and your legs steady, no matter your age. So, ask yourself, are you getting enough vitamin D? If not, it's time to make a change. Start today, and you'll thank yourself later. In this video, we explored the importance of vitamin D for maintaining strong legs and overall mobility in older age. As we age, muscle weakness and poor balance can make even simple tasks harder, but ensuring adequate vitamin D levels can help prevent these issues. Studies show that vitamin D plays a critical role in muscle strength and stability, and a deficiency can increase the risk of falls, fractures, and loss of independence. The key takeaway is that vitamin D is essential for maintaining a strong, active life, even in your 90s. The lesson here is to take proactive steps. Ensure you're getting enough vitamin D through sunlight, diet, or supplements. Don't wait until it's too late. Start today to safeguard your strength and independence. If you found this information helpful, don't forget to like this video, subscribe to our channel, and turn on notifications to support more content like this. Your health matters, let's thrive together.